The United States has the most expensive healthcare system in the world. In terms of things we can measure, such as life expectancy, it does not give us the best results. There are many different healthcare systems in countries around the world, and I believe we can learn by looking at different ways to solve the same problem. But whatever we do here, there are several challenges that we're going to face. One, older people need more health care. As we advance technology, we live longer, and this is good. We get more years of healthy and productive life, but at the same time, we get more years of disability at the end. And the easy cures were discovered first. Now each advance in healthcare technology tends to be more expensive than the last one. For electronic products, new technology always gives us more for our money. It's a little different in healthcare technology. Each increment of technology tends to give us less for our money than what the previous increment did. But we still want more years of life and health, so we pay more and more. 2, healthcare does not have good competitive markets, which are the key feature of capitalism. Now, when you want to buy a new car, it's pretty easy to compare the features and see what's the best deal for you. Competitive markets tend to optimize the price. Healthcare is much more complicated. There are 26,000 diseases listed in a database for doctors. Then there may be numerous treatments for whatever condition you have. Which one is best for you? Even doctors can't keep up with all the products available in their field, so they have to specialize. And even then, doctors don't know what's the right treatment for you. You may have to try several different treatments to see which one works for you, because we're all individuals. This takes time and it takes money. You may be able to choose your health insurance plan and your doctor, but you have very little choice about the actual product, which is treatment. Your doctor will decide which treatments to offer, and your health insurance will decide what to pay for. You, as a customer, are at the bottom of the totem pole for making decisions, and that's not how competitive markets work. 3, many people don't get preventive care, especially when they don't have insurance to pay for it. I don't think our doctors are perfect, but I do think that overall, our doctors know more about health care than the average person who likes to write articles or make YouTube videos. And doctors tell us to get annual checkups, plus vaccinations and screenings based on age. These items are part of preventive care. Now, Andrew Tobias told us back in 1982 that it's not a good idea to buy insurance for expenses that you know you're going to have. Insurance is good for expenses that we don't know for sure about. Some people will get cancer, some people have their house burned down, some people get their car smashed up in a collision, and so on. We don't know who's going to have which disaster, so we buy insurance, and that spreads the risk so that everyone can survive pretty well. If insurance covers preventive care, that makes preventive care more expensive because the insurance company has to process paperwork and make a profit on doing business. However, the insurance companies figured out that they can actually save money by covering preventive care, because otherwise too many of their customers skip these items and end up with more expensive health conditions. We have about 27 million Americans who have no health insurance, and many of them wind up in emergency rooms with critical illness. Somebody has to pay for their care. Whatever health care system we use, it's a challenge to include everybody. 4, public health is not valued here the way traffic safety is. We all expect to be reasonably safe when we go out in public. One safety issue is automobile traffic. We all have to follow the same rules to make sure we don't kill each other. Nobody says, I have a right to drive wherever I want to. If we could decide individually which side of the road to drive on, we wouldn't live long enough to be debating public health. Public health regulations are like traffic laws. They protect all of us from what other people do. During the COVID pandemic, many Americans claimed a right to refuse public health measures, most notably vaccinations. Now, this would not be a problem if the people who wanted their individual rights also accepted the responsibility to stay isolated so that they didn't infect anybody else. Well, that's not what happened, unfortunately. Asian countries have more cooperative cultures. Asian nations all had much lower rates of death from COVID. Johns Hopkins University collected extensive data and gave us these numbers for the death rates after 3 years of pandemic infections. I don't have data on the cost of hospitalizations and respirators for COVID patients, but I expect these are proportional to the number of deaths. So as an estimate, we spent at least 5 times as much as we should have on health care for COVID patients. 5. Finally, we can't put a price on life. Jerry Avorn tells us about drugs priced at up to $300,000 a year for each patient. The United States is the only developed country that allows pharmaceutical companies to charge whatever they want. Now just imagine for a moment that we had a set of drugs that would cure all illnesses, but the cost of these hypothetical drugs was more than the gross domestic product. So if we paid for the drugs, then everybody would die of starvation. So we have to set some limits on how much we pay for drugs and for health care in general. The best we can do to set reasonable prices on health care is by comparison. First, we consider health care in relation to basics such as food, shelter, and safety. We don't have miracle cures to give us eternal life. We have a lot of different treatments that give us different benefits. All other developed countries make an effort to put a reasonable price on each type of treatment by comparison with the other treatments available, keeping in mind that we can't spend all our money on health care. Insurance companies make a lot of decisions about how much to pay for which treatment, but they are not the customers. The patients are the customers. I think all of us should be discussing how much to pay for health care. And YouTube is a pretty good place to start. So I welcome your comments on my channel. Thank you.